Welcome to the Doctor's Life podcast. I'm your host, Dr. Dianne. Think of the podcast as a mobile doctor's lounge where we take some time out and explore topics that doctors are interested in related to what it means to be a doctor in today's world and creating a rich, satisfying, and meaningful life, as well as making the healthcare system better for doctors and patients. So, if you are a doctor, you'll feel right at home, and if you aren't a doctor, you'll get a better understanding of doctors and what we think about and talk about. I know you will enjoy the conversation. Let's jump in. Hey everybody, welcome to the Doctor's Life podcast. I'm your host, Dr. Dianne and Sari Wynn, and today we are going to be talking about being a medical mom. I have an expert in being a medical mom. Her name is Dr. Carolyn Fitzpatrick. She's a medical director at Dr. A.L. Burdick Family Medicine Center. She's associate program director of the Family Medicine Residency Program at West Suburban Medical Center in Oak Park, Illinois. And I have to say, like most of my guests, she's a good friend and an awesome person. Not that you have to be my friend to get on the podcast, but I do have amazing friends. So thank you, Dr. Carolyn, for coming on the podcast today.
Hello. Great to be here. Thanks for having me.
Fantastic. So Dr. Carolyn is a real expert in being a medical mom because not only is she an amazing family practice physician, and we've already talked about the credentials and all the jobs that she has, but she has 4 kids, ages 8 through 17. And she had her first child, the oldest, when she was an intern. So, Dr. Carolyn, we'll just start with the very beginning with having your kids during your medical career. So, since you had your first while you were in internship, what was your experience with pregnancy during your internship?
Sure. I was pregnant during my 4th year of medical school and, went through interviews and matching while pregnant, and that is its own challenge. As an intern, I delivered in September of my intern year. That was definitely a challenge. And lucky for me, I'm in a specialty and matched into a program that I felt was supportive of me. And that was very important for me to consider as I was choosing my rank list for residency programs.
Yeah. Well, let's go back. I'm curious about your experience being pregnant as a 4th year. And then you had said that it has its own challenges to do your interviews while pregnant. So let's talk about that. I'm sure everybody that's a medical mom or is in med school thinking about having children, they'll want to hear it all. I
do. Sure. Well, first of all, I was a non-traditional medical student. I had actually worked in pharmaceutical industry for about 5 to 6 years before starting medical school. I was already married when I started medical school. My husband and I wanted to at least wait until I was further along in medical school before considering pregnancy. But of course, as I was getting older, also wanted to make sure that I still was able to have a family. And as, a lot of these things happen, we try to plan things. And a lot of us in medicine who, feel like we want to plan every aspect of our lives. As mothers, we also want to plan every aspect of our pregnancy. But the truth is that pregnancy comes when it comes. And for me, it just happened to be during my 4th year of medical school, which actually worked out well. That was a good time because during 4th year of medical school, the schedule is a little bit lighter. You don't have as many rotations to do that, require you to be in the hospital and on call as much during your 4th year. So that aspect of it worked well for me. And when I started my residency interviews, I was pregnant, but not very visibly pregnant. It still made it difficult to choose an interview suit, but
Sure.
but in terms of programs, basically knowing that I was pregnant, they couldn't probably really tell. But as I went on in my pregnancy and as it got closer to the time of matching, it became more and more on my mind that I want to make sure that I'm at a place that is going to embrace me and embrace the fact that I'm pregnant. And so I'm not saying that I recommend people necessarily do this, but it was so important to me that I actually talked with the program director and let her know that I was pregnant and expecting before I put in my rank list for match, because I didn't want to be someplace where the environment wasn't going to be welcoming. Actually, within my residency program, once we started, found out that there were actually 2 other women that were pregnant in my intern class as well.
Oh, wow.
And that was just by chance.
Yeah.
There were 3 of us in that intern class, and we couldn't not have planned it any better, because as one delivered and went on maternity leave, and then came back, then the other one delivered. So there was one of my classmates who had her baby at the end of our orientation week, which is at the end of June. And she went on maternity leave, and then she came back, and I had my baby in September, went on maternity leave. And then when I came back in December, then the 3rd woman delivered her baby in December.
Oh, wow. Yeah, that was 1, 2, 3. That
1, 2, 3
really went well.
Yeah.
Well, because that can be an issue, where, and you can speak to this, but I remember when I was in internship and we had one guy leave during internship. And so that ended up putting additional work and additional rotations on the residents that were remaining. And we actually had a verb for it. The guy's his first name was Babak. And so the verb became like, you got babaked, when you had to do an extra, rotation of HEMONC or NICU. So,
yeah.
So did you get pushback or,
I didn't feel that I or any of my other classmates who were pregnant receive any pushback. But the program was very flexible in dealing with scheduling so that it would allow each one of us to take a maternity leave and spend time with our newborn babies and still not adversely, affect the residency program very much, so that no one else felt like they were being, shortchanged by having to do a lot of extra call.
Right.
So, yeah. And, I guess the other thing in also being pregnant during residency training is I actually was on call when I went into labor for my first child.
Oh my goodness.
So, yeah, I was on our family medicine service seeing, adult inpatients, and, remember doing my admission that evening for a patient with an asthma exacerbation. Wasn't too busy, so felt like, about 10 o'clock or so, I could go to the call room and kind of relax a little bit. I called my husband, let him know that I was fine, and I was going to go to sleep for a while, try and catch some sleep while there was a little bit of a lull. And my water broke when I was in the call room. I called my senior resident to let him know, I think my water just broke. And being the wise senior resident that he was, he said, go directly to the OB floor and I'm going to meet you there and I'll take your pager.
Oh, awesome. Take your pager. Awesome. Oh, that's great. Let's talk about maternity leave. What was your experience taking maternity leave? how long were you able to take maternity leave? I was already in practice when I had my first. But there's so many different experiences of maternity leave when you're in training or if you're in practice. So do you mind talking about that?
Sure. So I, during my residency, took a 3-month maternity leave. I'm just very fortunate that our residency program was very supportive of that. So I did take a full 3 months and very happy that I was able to do that. And for my subsequent children, I took various different times for maternity leave. For my second, I was actually during the last year of my residency, during my 3rd year of residency training, I was pregnant with my second and actually had accepted a position as the chief resident for our program. And so I took about a 2-month maternity leave with my second. And with my third, as an attending, took somewhere in the range of about 2 months of a maternity leave as well. And then for my fourth, I think I took closer to the full 3 months.
Wow. Yeah. Well, I want to underline that, some people think that pregnancy is a deterrent to advancement, to being respected, whether it's in training or whether it's in your group. And so I wanted to underline that you actually got asked to be and were the chief resident in your program, despite being pregnant and taking leave, because some people would look at that as a negative. I think that speaks to, and you can comment on this, but being mindful of how accepting your residency program is going to be about the potential that you might have children while you're in training. It's a long stretch. I mean, that's at least 3 years of our lives when we are in a time where we're often looking at having a family. So I think that's important to consider. I certainly didn't. I just went into it like, hey, great, they accept me, awesome, and just didn't really think about it much. I love that you're sort of planned it.
Sure. Yeah. Well, I would have to say that I knew that I wanted to have a family one day. My husband and I knew that we wanted to have a family one day. And I really think that probably when I was thinking about my medical specialty, what I was going to choose to go into, that I did consider that as, part of my choice, which is I knew that I wanted to, not only at least have one child, I never knew that I was going to have 4, but I wanted to have a family and also be able to be involved with my family and, raising our children. So for me, and also again, I was a non-traditional student. I was a little bit older. And so I maybe processed some of these things a little bit differently than, maybe some others at that stage of training. I think for anything, it's really important to think about the environment or at least for me, that I chose to be in, mm-hmm. and making sure that I was with people that wanted me to be there for who I was and people who I enjoyed. As a resident, you actually are choosing almost your second family, mm-hmm. because we spend so much time with the people that we're doing our residency training with. So that was a big factor in me choosing where I wanted to go for my residency training. I think for any of us, it's, you want to choose people who are going to be allies and advocates for you, and people who really see you for your true self. And so I'm just really fortunate that all of those things kind of aligned, and that also helped me to kind of go along the path in not only my training during residency, but then after, in order to, develop a career in academic medicine.
Mm-hmm. Yeah, Dr. Carolyn, that is good advice, whether you're able to have a baby or not. So we're talking about medical moms, but for those of you who, if you're male, you can't get pregnant, and if you're deciding maybe children aren't going to be part of your life, regardless, that is great advice in terms of choosing a residency program.
Yes, I mean, we also support our male colleagues who, decide that they would like to take a paternity leave when their wife or significant other is expecting a child. So I think, it goes both ways that, we as women want to be supported when we're pregnant and having babies, but we also want our male colleagues to feel supported as well, because I think the presence of fathers in their child's lives are very important as well.
Yeah, absolutely. We actually did a podcast with Dr. David Droginas. So if you guys want to listen to another podcast from a male's perspective, a dad's perspective about fatherhood in medicine, then check that out. That was probably, let's see, we're recording now in March of 2020. So that was probably sometime in 2019. So go and find that one, Fatherhood in Medicine, with Dr. David Droginas. He's amazing. And so that would be a fun listen as well, you guys. So getting back to you, Dr. Carolyn, when you come back from maternity leave, there's a whole nother world that opens up. So next we're going to talk about breastfeeding and childcare and your husband's involvement in taking care of, how do you create not just your husband, but like how do you create a universe in which your infant is supported since you have a demanding career. But first, like the nuts and bolts, because there were a lot of times when you come back, you still want to at least provide breast milk to your child. So, so were you able to do that, or?
So each child was different in terms of breastfeeding. I would say starting out for a first child, breastfeeding was more difficult in the beginning, especially. And so I would say my first child was the one that I didn't breastfeed as long as my other children for many different factors. One is it's hard starting out. And as a family medicine physician, we do a lot of coaching for our patients to do breastfeeding. And when you're doing it yourself, you realize how hard it is when you're first starting out. And my firstborn, he was full term. He was right about 37 weeks, but he was a little slow to latch on and those sorts of things. So when I returned from my maternity leave back into my residency training, it was difficult for me to, do pumping and all of that. And I really gave it a good go when I came back to the residency program. So I probably did maybe a month or two of extra time of pumping when I returned to my residency training. And then after that, it was too difficult for me. It was easier for the subsequent pregnancies than I did breastfeed longer for my second, third, and fourth children.
I love it. I love it. You got quadruple the experience.
Yes. I spoke about my other co-interns who had also delivered babies during my first year residency training. And for some of them, it was very easy. We could go to rounds and they could go into the call room and pump and be just fine and then go back. And everybody is different. And for me, it just didn't work well for me schedule-wise at that time. But it doesn't mean that you can't do it. I would encourage the moms out there that no matter when you have your babies, to make sure to advocate for yourself, to make sure that you have areas where you can go that are private, that you can pump and provide, breast milk for your babies.
Yeah, that's definitely become an issue or a topic that's being more and more discuss how to make those accommodations. And I think that overall, we hear a lot of the struggles of women being able to make that time or find the place, even if they have the time, to be able to pump while they're working. And we won't even get into that the experiences that all working women have, which is, they hear a baby crying and, you make sure that you have your pads on so that your blouse doesn't get wet. Yes. Like all that fun stuff that that any working mom would have. So, but I love that you say that we should just advocate for ourselves. And I would say too, don't feel that you're just a lone cry, in the wilderness, that there is support reaching out to your colleagues and even folks that might be in more administrative positions, that it's not an optional thing. I definitely felt when I was in a little earlier era than you were having my kids, and I was anesthesia. So, we were kind of we weren't on rounds or anything. We were in the OR and expected to be in the OR all day. So I didn't really advocate for myself. And I switched over to formula when I went back to work, except for, doing some pumping and then keeping breast milk in the freezer. But so there's more than one way to approach it, to be sure. But I think what you emphasize, which is really important, is that we as women are entitled to have options in our careers. And this is certainly one of them.
Yes, absolutely. And the other thing is, as medical moms, I think we're often very hard on ourselves, and that you don't know how the experience is going to be until you actually do it and go through it. So if something turns out differently than you thought it was going to be, don't be so hard on yourself. It's okay. It is okay. And we do the best that we can with juggling all of our priorities. The most important thing is that we are having our children and our families in a space of love. And that's what's most important. And the babies get what they need somehow, some way.
Somehow, some way. They do. Oh, so that brings us to what I was mentioning before that we were going to chat about, and that is building a supportive community around us for ourselves and for our children. Would you mind speaking to your experience around that?
Sure. My husband is very supportive. He's also one of those dads that's very hands-on. So that makes it very easy for me in some ways to do what I need to do. I also have family in the area where I'm working. So when my kids were young, my sisters were supportive of us having the young kids at home and being able to watch them, provide some childcare for us. Along the way, we have utilized many different options for childcare, using family, using in-home care, using traditional daycare centers. We've done just about everything. The only thing that we haven't had was a nanny. Mm-mm. But for us, we wanted to do as much of the hands-on parenting ourselves. And when we couldn't, we utilized other options to help us through the way. I would say the one thing that I feel that we learned most through that process was that if you make a decision for childcare, you don't have to stick with that the whole way through. Mm-hmm. Maybe there's something that works for you at that time, but maybe as your situation, circumstances change, that maybe what your needs for childcare might change. And it's okay to make a change down the line.
Mm. Yeah, that's a good point, because I think we tend to think like there's only one size fits all. And it's interesting to consider that it doesn't have to line up, like one family chooses a nanny, one has an au pair, one does family, that you can mix it up, and you might well have to mix it up as you go along. But I can attest that Dr. Carolyn's kids are all well adjusted, and they're amazing kids. So as she was saying before, I will underline, and I had the similar experiences with my children. We had primarily in-home care, but we didn't always have the same caretakers. And there was one way that we did it, but I think the main thing is that that they do love and keep your kids safe. We had one caregiver, and she was basically like a second mom to my kids. They started when they were infants and went through most of their grade school years. And I'm finding out later that, there are some things that she did and the things that they learned from her that I might not have taught them, although she was basically in alignment with my parenting style. But yeah, later on you just find out these things, and they're not harmful, but they're not exactly what you would have done. Especially, with that first child. I wanted everything perfect, and, I wanted them to do things the way that I would do. And I think that it's important to be flexible and keep in mind the big picture. I just started thinking about what it's like to be at work and have your kids away, away from work. Did you find it distracting? Did you make a lot of phone calls home? What was that like for you?
For me, it was very important to feel good and trustful with the situations of childcare that we had established for our kids, because I needed to be able to focus when I was at work. So I was not one of those moms who was constantly calling and checking in or that sort of thing. My husband, again, who is very hands-on, very capable of taking care of the little ones. And I felt that I just needed to allow that trust to stand there. Again, with any other childcare situation that we chose, I felt comfortable and confident in those choices, decisions, those individuals who were caring for our little ones, so that when I was at work, I could be completely focused on what I was doing. Now, at the end of the day, when I was not on call overnight, we were constantly, checking with each other, my husband and I, making sure who's supposed to pick up the little ones. We didn't want to have any mishaps and forget to go to the daycare center or leave my mom or my sister hanging for long periods of time with the child in late hours in the evening. But with the hours that we work as a physician, that is another concern and consideration in choosing the type of childcare that we might need. So especially with overnight calls, and these days, night float is so much more frequent, at least than it was when I was a resident. So those situations definitely present challenges for doctor moms, medical moms, and families. So again, I would just urge people to pick the right childcare that you need for that time. Be open, be flexible, even though you might have to choose a different childcare situation than you ideally would want to have. What you want to just make sure is, again, what you were saying, is that you have someone who is competent to take care of your child, make sure that they're safe, so that you can also focus at work when you because that's your job. That's what you need to do. And then when you're at home, you can love on your kids as much as possible. But when you're at work, you need to be able to be focused at work.
Yeah, absolutely. And I found that too with my work. I mean, it's when you're in the OR, you can't be thinking about calling back to make sure that something's done. And again, the main thing is to have trust from the get-go so that you feel like you can get in your car and get to work and switch gears like we all do and switch into Dr. Dianne and Dr. Carolyn, which is, as you all know, is a different persona than you necessarily have when you're outside of the hospital or outside of the clinic. And that's a persona that we've developed over time. And it makes sense because, we are professionals. And so to develop that professional self comes naturally as we go through training. I kind of find it to be like if you're too leaky, then you're not effective at work, and you can't be home anyway. So you might as well be fully at work. Something that comes up still, is it possible? I mean, we've talked about that we both have had families while we've been in training, but the question still comes up about the feasibility of having a family. If this were like a done deal, then we would not necessarily be talking about this. It would just be assumed, and we'd be talking more about the nuts and bolts of things. But we've actually been talking about how to navigate having a family in a medical world, and women and men decide whether or not they want to have kids. That's one thing. Should one decide whether or not to have children based on whether or not you're in medicine? You're associate program director in family medicine. So I'm curious to hear your thoughts about this. You've seen plenty of young doctors go through your program as well as experiencing this yourself.
I think that having children, having a family, it's a right of life, and doctors should not give that up. You don't have to give that up. And I think that we, just need to have the right situations in order to make it feasible for us to do. And we want to make sure that we're in situations where we also are able to balance our lives, not only professionally, but also with our families as well. Our jobs are, very involved, but we also want to be able to have the time to spend with our families as well. So those are just the choices that we have to make in life. We can always work more, work harder, but if you want to have a family and also have a career in medicine, you can do both.
Mm-hmm. Yeah. If that's what you want, then you should do both.
Yes.
And as we've talked about, Dr. Carolyn has so eloquently discussed that it's not easy. She's been very successful in her field, family medicine, and in academic medicine. Sometimes the question comes up, well, should I opt out, so to speak, and to go into private practice, with the thought that it's somehow that might be more accommodating for having a family. But Dr. Carolyn has shown that you can have both. You can have a career in academics and be able to shape physicians as she has done over many years, and guide them and still have a rich family life. So,
yeah, I think that physicians should practice the medicine that they feel they're most passionate about and do what they feel they want to do in their careers. You can do those things and also have a family.
Awesome. I completely agree. Do you have any last thoughts, Dr. Carolyn?
No, I think maybe just one other thing. And when I spoke about some of the choices that my husband and I made in order to have support for our family, not everybody has relatives close by that can help them out when they are pregnant or, have young children at home. I do know that people that had young families and didn't have relatives around did develop other resources in order to help build that network for their families. For some people, that may have involved a network of friends or church members or having more extensive hours for childcare with that nanny or au pair or whatever. But regardless of the situation, even in two physician households, there is a way to develop your schedules and support so that you can have a family and be able to still be focused on what you need to do for your career as well. It's just developing the resources that you need.
Thank you. Thank you. I think that what you've provided, Dr. Carolyn, is not only practical tips, but so much encouragement and wisdom. I so appreciate your coming and participating and helping us understand better what medical mom can be, as well as what your experience of being a medical mom. So thank you so much.
Thank you. Thank you.
Yeah.
Glad to be here.
Yeah, absolutely. So we've been talking with Dr. Carolyn Fitzpatrick. She's a medical director of the Dr. A.L. Burdick Family Medicine Center and associate program director of the Family Medicine Residency Program at West Suburban Medical Center in Oak Park, Illinois. Thanks again, Dr. Carolyn, for being on the Doctor's Life podcast.
Thanks for having me.
Oh, you're welcome. Well, thank you guys for listening to yet another episode of the Doctor's Life podcast. Be sure, if you enjoyed this podcast, to subscribe. That way you'll be able to get every episode as it comes out, and recommend it to your friends. If you'd like to listen to more podcast episodes, you can certainly find them on the same podcast app that you found this podcast on. And if you'd like to know more about me and what I do, you can check it out on my website, drdianne.com. That's drdianne.com. Till next time that you listen to us, I hope everybody stays happy and healthy. Take care. Thanks for listening today. If you like what you've heard, be sure to hit subscribe in your podcast app so that you won't miss an episode. You can also read show notes, get links, and contact me by going to drdianne.com. That's www.drdianne.com. And docs, while you're there, take the Physician Vitality Assessment, which will help you more clearly see if you are at risk for burnout.